All right. Well, looks like folks are getting logged in. Let's get things rolling. I'm going to introduce today's webinar like this. I'm a bit of a micromanager sometimes, all right, to be honest. I like to look stuff over. I like to check out the look and feel and polish of everything. And Kimberly knows this, and she always, submits stuff to me and says, okay, I think this is ready. What do you think, etc. And I always offer a couple of suggestions because I'm a micromanager. Well, I have not done that for this webinar we're going to see today. In fact, I don't need to do that. Kimberly's that good. I don't have to micromanage. And so this is going to be a complete surprise to me today. I will see it for the first time when all of you see it. So I'm really excited to find out what we're going to learn today. Kimberly has done all of this on her own, and this is going to be great. So she's chosen the title, Sealing the Deal with Auriculotherapy. And no doubt she's going to tell us a little bit more about what that means. And so without further ado, I'm going to turn it over to Kimberly Thompson. Take it away.
Well, thank you. I'm excited to be here. So there's been a lot of discussion lately about auriculotherapy. And honestly, if you've been with Meridia Technology for any amount of time, you have read blogs, you've read articles that I've written, you've seen videos that I've created. We're going to talk about some of those within the webinar. And then what you need to recognize is that there is a PDF handout that will be given to you. And with that handout, you'll be able to have access to all of the videos that we talk about and some other resources within this webinar. So if we share a link, don't worry, because you will have that information on the PDF handout. So don't feel like you have to scramble and worry about that. So I am going to get started here, and let me just share my screen. The title of today's webinar is called Seal the Deal with Auriculotherapy. And I have been doing auriculotherapy. Obviously, I learned it when I was in college, and I learned it on a simple level at that point. And have just expanded my knowledge with auriculotherapy over the years. And so you're going to learn several things from me gained on that experience. Let's see. So what you're going to learn in this webinar is how to recognize your potential as an auriculotherapist, how to take a look. We're going to take a look at where you are right now and analyze your skill level now and where you're at, where you can become, what the next levels for you are. And I'm going to share some things that I've learned along the way in my advancement based on clinical experience. And then I'm going to share, I've been to a lot of extra training on auriculotherapy, and I'm going to share some of the things that I have learned along the way. So I will move on here. So your potential. There are a lot of different types of auriculotherapists or acupuncturists in the world who use auriculotherapy. I have been able to, because I travel all around, even in other nations, to meet different acupuncturists in some countries. If you're a physiotherapist, which would be similar to a physical therapist in the US, if you're a physiotherapist, you can do auriculotherapy. There are physical therapists, there are clinical counselors, there are a lot of different ranges of people who can do auriculotherapy. I have talked to many auriculotherapists along the way who that is all they do. And they have whole clinics that are specific to smoking cessation or weight loss. So any direction that you want to go in auriculotherapy, the opportunity is there. When I was in college, I was introduced to the possibility of going into drug therapy. There are a lot of medical doctors who will supplement with auriculotherapy. So there are a lot of different directions that you could go. The ear is a very powerful tool. The reason that auriculotherapy is so good and such a sought out field in acupuncture is because it simply works. There are 4 nerves in the body that come through the ear, and because of the vagus nerve is the main one. So there's an auricular branch that goes from the vagus nerve to the ear, and simply by treating the ear, you are affecting so many aspects of the body. In fact, if you just think about the vagus nerve, and if you do a little research on the vagus nerve and you look at all of the organ systems that the vagus nerve, I think it's cranial nerve number 10, that it affects the whole middle jowl, all of the organ systems in the middle jowl. And if you think about how acupuncture channels, if you're looking at the channel pathways and how they will start in the chest, come through the arms, then come up the face, and then come down the middle jowl, and then back up the middle jowl, all acupuncture channels have to cross the middle jowl. So the fact that the vagus nerve itself is very specific to the ear, that is one of the reasons why auriculotherapy is so powerful. The vagus nerve alone affects stress, the immune function, inflammation, and they've even done research to say that electrical stimulation of the vagus nerve, it helps to eliminate inflammation. So if you're working with disorders of the gut, you can get fabulous results with auriculotherapy. The vagus nerve also regulates the parasympathetic function as far as digestion, respiratory, cardiovascular, and along with stimulating memory and almost anything that you want to do within the body in relation to acupuncture can be stimulated via the vagus nerve. That is why the ear is so powerful. It is often the gateway into acupuncture. So other therapists beyond licensed acupuncturists, when they learn some type of acupuncture, often it's auriculotherapy. And then that is sort of the shingle that they hang, saying that there are a lot of practitioners who, if they're doing acupuncture and they just learned a small amount of acupuncture, auriculotherapy is the thing that they walked into with it. The reason they fall that direction is because with auriculotherapy, you can get immediate results. It's fast, it's effective, and it works. And many practitioners use it as a standalone treatment. So I think we will move on here. So the truth of auriculotherapy is that it's not hard, and anyone can do it. And I put anyone in, I should have put quotes. I'll talk more about that. Anyone can do auriculotherapy, and it just depends on which level they are doing auriculotherapy. Most other practitioners beyond licensed acupuncturists study auriculotherapy more than a licensed acupuncturist themselves. And I say that from my own experience. The amount that I learned about auriculotherapy in getting my master's degree in acupuncture was very minimal in comparison to someone who's stepping into the world of acupuncture from an outside therapy, let's say chiropractor or naturopath or whoever is, depending on their state licensure, they'll study auriculotherapy even more than I did in college. And so that's something that's important to recognize. So who's doing auriculotherapy? Obviously, there's the licensed acupuncturists, MDs, nurses, chiropractors, physiotherapists, clinical counselors. Believe it or not, one of the very first trade shows that I went to where I was introducing my clinic here in Idaho, I went to a show that was a CEU event for clinical counselors, and it was loaded with clinical counselors. And they were so fascinated with coming to my booth and talking to me because many of them heard about their opportunities for continuing education in order to do auriculotherapy, and all that they would, if they went to the training, the only thing that they would be allowed to do was one protocol. And we're going to talk about that protocol in a moment, but they can be certified in doing one specific protocol because it fits into their scope of practice. And so these clinical counselors were fascinated with learning from an acupuncturist who does auriculotherapy. So I write the word massage therapist, estheticians, and your patients, and I put question marks by each of those. So before you get offended by the fact that the possibility that a massage therapist, an esthetician, your patients, or a clinical counselor might be doing auriculotherapy, let's talk about that for a second. If you think about acupuncture in general and you're talking to someone that you met and they're like, oh yeah, I heard about that. And there's this point on my hand, and they'll push on LI4 and they'll say, I've got this point and it stops headaches. Or they'll push a point in their temples and they say, oh yeah, and this point stops headache. And I heard that this point does such and such. They're really just using trigger points. And the reason that large intestine 4 is such a fascinating point for just general people who are pushing on points is because it actually works. And the same thing happens with auriculotherapy. There are many points on the ear that actually work. You do not have to use a needle. You don't have to use a special device. You simply have to look at a picture and know where a point is. So if you look at the ear and you look at all of the points everywhere on the ear, obviously further education will have to take you to know and understand what all of those points are, and to know and understand how to use them and how to use them at different levels. But simply using pressure on the ear, if you know what point to use, you can get immediate results, and you don't even have to use a needle. So therefore, my statement about a massage therapist, an esthetician, or even your patients, I like to teach my patients certain acupuncture points on the ear and give them an avenue on how to treat them for self-help in between. And oftentimes it's ear seeds or pressure. I will print out a report for them or a picture so that they can take a look at those points. So we'll talk more about this in a moment. Let's move forward. So the next step, if you are an auriculotherapist, you're obviously interested in auriculotherapy if you've come to watch this webinar, and there are all different skill levels for auriculotherapy. And the big question is, which level are you? I've learned through my own experience, there's good, better, and best. Had you asked me, good in the beginning when I graduated from college, and people would say, oh, so you do acupuncture and you do auriculotherapy. Are you any good? Sure, I'm good. And we'll talk more about that. But I'm going to talk about the levels of good, better, and best. And I'd like you to kind of take a look about where you're at. In fact, it would be fun to do a poll at this point. I don't have a poll up, but go ahead and throw some information on where you think you're at skill level in auriculotherapy before I go further. And I'll define good, better, and best as we go. But how much experience do you have? How often do you use auriculotherapy? Do you use it every day in your clinic? Is it something you want to learn more of? Do you feel competent in what you're doing? So I'm looking for a little bit of chatter on that in our comments section. And when I see a couple of statements, I will move forward, because I don't want to tell you what good, better, and best is until you tell me how far you've been. All right. So Robin says she uses it daily. She supposes that she's good. Minimal experience. However, until I use it all the time for seasickness on ships and get great results. I like that on practically every patient. I know that when I first started as an acupuncturist, I was using it all the time on every patient as well. And it'll be interesting as I tell my stories and where I found myself in the end after doing this analysis. Okay, I'm going to move forward, and I appreciate all of you chiming in. This is helpful for me. I like Elle says they mostly use Shen Men, and that's not a bad thing. That is very powerful all in itself. So let's talk about good. Good means that you use a handful of points and you have some basic knowledge. Think about, with that, I'm going to put good in the range of all of those people that I put on my list with the question mark. Those people who are using pressure points, they fall into this category of good. And if you have a handful of points that are helpful and they help your clinic, then that is fantastic. Shen Men, all in itself, I mean, I could show this picture to anyone and they could go, oh, I see where that point is. I bet I could treat it. You could take the end of a pencil. Not that I would say that's the smartest thing to do, but you could treat that point with pressure. You could put an ear seat on that point and you can get fabulous results because it is wonderful. A while back, there was, I did a little research and it's been a few years. There were 180 protocols at the time in our Auriculo 3D program. And out of the 180 protocols, 164 of them included Shen Men. Why do you put, and those protocols, I didn't make up those protocols. They came from other practitioners, the masters in the field, and all of them included Shen Men into the process. So if you look at what Shen Men does, I mean, I got a list. It calms the mind, stress, anxiety, depression, pain, tension, restlessness, insomnia, cough, fever, inflammatory diseases, epilepsy, high blood pressure, helps all other points work better. It is the key point for alleviating pain. So you could call yourself good in auriculotherapy if you're simply adding Shen Men into every treatment. If you're not using Shen Men on a regular basis, I would say you're missing the boat, because even an average person could add Shen Men into their life and have a better quality of life. It's hugely powerful. And so if you have a handful of points that you are using to supplement your treatment, then you are, and you have some basic knowledge, then you are good at auriculotherapy. I left college and I was good at auriculotherapy, but I would say that a massage therapist who is using some points and using pressure points, they are good at auriculotherapy. I would say I have some patients who are good at auriculotherapy because they have a handful of points that are helpful and they're using pressure points. And I have no problem with that. I actually think it's important to teach these things to patients. I have a story to share with you. So several years back, I had a lady call me and she was calling to ask questions about Acugraph, and she was overwhelmed at the time because she had 600 new patients. I'm not exaggerating there. She had just gotten 600 new patients. She had done the Groupon sales, and she said she would never do it again. And I asked her what her experience with that was, and she said she learned so much about herself. And she was overwhelmed with all of these patients, and she had to create a system and she had to figure out how to get them all through. She said she made a chunk of money up front, which helped her do things, but 600 new patients. I struggle when I have 4 new patients in a week because I'm not sure how to fit them all in with my regular patients. But with 600 patients, one of the things that stuck out to me in our conversation was the respect that she had gained for auriculotherapy. And I said, tell me more about this. And she said she began using Shen Men, 0.0, and the sympathetic autonomic point on every single patient. And if you look at the indications for each of those points, she was able to put the body into balance just simply using those points. And I won't say that she didn't do anything else in her treatment, but she shared with me that the majority of the results she got, she believed were specifically from using these 3 acupuncture points. So add those to your arsenal of a handful of points. I mean, if you've got Shen Men, 0.0, and the sympathetic autonomic point, you are going to be a good auriculotherapist. Another handful of points that is hugely powerful is the Nada protocol. And this protocol is one that I did advanced training on when I was in college. It was my very first auriculotherapy course. You know, I paid the student price and I went and I learned about the value of these points. I did 2 days worth of training, and I'm going to talk more about that later when I share some tidbits of what I've learned from masters along the way. But I learned how powerful these 5 points are, and they are a standalone treatment. They are well researched. There are research articles written on them. This is a base treatment that you can be a successful auriculotherapist in the work field only using this protocol, and you are good. And then another handful of points that I used along the way were the TCM points. So when I was in college, when I took my auriculotherapy class, it was just before it was time to become an intern, and there were huge exams that I needed to take and lots of memorizing that I needed to do. And so I used that time to study what I had to study in order to pass exams. And knowing the TCM points was really important because I was in a TCM school. So one of the things that I did to supplement my body acupuncture was add points in the ear to my TCM. You know, if I was treating spleen qi deficiency, then I treated spleen and stomach. If I was treating liver yang rising or liver overacting on spleen, then I treated liver and spleen. Adding these points to a baseline body treatment absolutely exhilarated the treatment. It brought it to a whole new level. So again, a handful of points. Okay, so I have one more category to share, what puts you in the good acupuncturist category. So we talked about the well-researched points. We talked about a handful of points. We talked about the key TCM points you learned in school. And the next level is what you'll learn on Google. People are fascinated with auriculotherapy. I'm sure you get the phone calls. I get the phone calls all the time. I said, I heard acupuncture could help with such and such. Can acupuncture help with weight loss? Can acupuncture help with smoking addiction? Can acupuncture help with stress? So there are earseeds.com. The guy who developed this company actually graduated from the same college that I did, and he developed a system with basic pictures of the ear where average people can take an acupuncture point, put an ear seed on it, and press on it. You know what? I think this falls in the good with auriculotherapy category, and I don't think there's anything wrong with it. It has not taken anything away from my business. I actually use the ear seeds. I have them out for sale in my clinic, and my patients will say, hey, can I get that? Or could I help? My brother's trying to quit smoking, but he doesn't really want to see an acupuncturist. Can I give him these ear seeds? And I tell them, sure, give him the ear seeds, anything that will help him. If it's a pressure point that's going to help, if a massage therapist is using them and a clinical counselor is using NADA, why can't you throw on a few ear seeds to supplement your life and make you feel better? Let's see. I sell a lot of them during the holidays because people will stick them into Christmas stockings, and they're kind of fun. So you're a good auricular therapist. Okay. It doesn't make you great. It doesn't give you any skill. If you can look at a picture and see where a point might be and put a seed on it and press on it, then you fall under the good category. So here's what you want to recognize. When good is no longer good enough, then you step it up and you become better. And I'm going to talk to you a little bit about that journey. One of my first assignments when I came to work for Meridia Technology is that I was given a stack of auriculotherapy books from all of the masters, and I was asked to research them all, see what commonalities were, see what things were in the different types of strategies for treating ears, come up with a database of information that acupuncturists can become better at auriculotherapy. So in that time, I was studying with, from all of these masters. I learned that there were different theories on treating auriculotherapy, just like there are different theories with treating acupuncture. I learned that all opinions about point location are not created equal. I can't tell you how often I'll have somebody call me and say, Kimberly, in your auriculotherapy program or Meridian Technologies program, this point, I was taught that it's in a different location. All of the books out there are literally graphic design creations of where the author sees that the point is. With further research and further knowledge and further education, which I'll walk you through as we go through this webinar, you'll learn that a point is not always in the same place. So there's a general area. There are more advanced ways of finding exactly where that acupuncture point is. So this is important to recognize. I learned that there were many modes of treatment, and I learned the things that I didn't learn in college. In college, I learned enough. I learned how to probe a point, how to recognize discoloration in the ear. I learned clean needle technique. I learned how to needle a point. I learned what to do to pass an exam. So as I did all this research, I was fascinated and excited about the next level of auriculotherapy. So as you become a better auriculotherapist, all of a sudden, you don't just have a handful of points, you have access to protocols. You have a handful of now you have a handful of those protocols memorized. And the reason you have them memorized is because they flat out work. You know the difference between active and inactive points. So if I was a good auriculotherapist, I'd look at a chart and go, oh, if I'm going to lose weight, I need to put a sticker on all of these points and push on them, and they're going to help me lose weight. Well, as you become better, you realize that, and whether it's weight loss or shoulder pain or anxiety, whatever protocol you're looking at, you learn that some of those points are active and some of those points are inactive. You learn that points that are electrically active are the ones you actually need to treat. And you might have a whole list of points in a protocol, but it doesn't mean that you treat them all. And then all of a sudden you're getting much better results because you have more skill and you're taking it to a new level. Another level of better is that you can resolve pain. You don't just have a list of NADA protocols or parasympathetic Shenmen and 0.0 to put the body calmly into balance. You actually can fine tune your treatment and find those electrically active points and treat pain and have pain magically disappear. Your treatments become more effective because you're treating body points, but you're using auriculotherapy as a branch treatment. And because you're doing this, you're getting better results. You also become comfortable using multiple tools. Before, you might have stuck an ear seed on a point or quickly stuck a needle in, but when you realize that you can treat with laser and you can treat with microcurrent, and you can, as you're finding electrically active points, and you can pick and choose what type of treatment is the best for your patient, that takes you to the better level. When you reach the better level, then you start hearing things from your patients like, wow, you're amazing. You get the hug and the tear in the eye at the end of your treatment because your patients are so relieved for the relief, so happy for the relief you've given them. Let's see. In this process of becoming better, for me, that was the creation of Auriculo 3D. And when we created Auriculo 3D, Adrian came to talk to me and he said, okay, Kimberly, you're fresh out of school. What would benefit you the most in practice? And where I was struggling is I loved auriculotherapy, but I had to look up points in a book and see all my highlights and all my notes. And I'd put a book on the patient's belly, and I didn't look like I was very professional or mature in my treatment process, which I wasn't, right? So Auriculo 3D became a place where I could put in a symptom and a protocol would come up, and then it was a whole list of points. And then I learned through my process that I didn't necessarily have to use every one of those points, but it gave me a baseline and a place to start. And as I began practicing, then I became more confident. And then I realized my potential grew in that process. And so it was created. If I was a student and had the Auriculo 3D, it would have been helpful because I could put notes in it. And if a teacher taught me something that was important, then I had a database where I could keep it all. I could create my own protocols as I became more mature and more ready. And as I became a seasoned practitioner, then it became this great big database filled with information that not only was the baseline that the program came with, but all the information that I had put into it. So that was kind of Auriculo 3D. Ear Cure was the next level. So after Auriculo 3D was created, then we had so many practitioners who were excited and they were using auriculotherapy more, but they had 100 questions. They had the same type of education that I did. They got the baseline when they were in school, but they weren't given all of the advanced information that I had gained along the way. So Dr. Larson created this book, and in the book, we worked together and we basically wrote it because there was a missing link. We wanted to help those who were already good but wanted to be better, and we wanted to teach them about microcurrent and all the different tools that were available to them, and treatment protocols, how often to treat, the contraindications. We wanted to treat, we wanted to give them a comparison of tools so that they could move forward to the next level. So at this point, my confidence increased because I just began treating, I could go directly into my program and get more protocols and pull them out and get better results. So not only did my confidence increase, but my productivity increased. Eventually, I developed a passion for the Stim Plus Pro. That was, I started out just using needles in the ear and ear seeds. And then I moved on to using the Stim Plus Pro because the Stim Plus Pro helps me find the electrically active points. And it is my all-time favorite device to use on the ears. Although it is still my all-time favorite device. This picture is of me and Jake Fratkin. I'm actually teaching him how to use the Stim Plus Pro and how to find the electrically active points. So, as you become better, then you have information to share. And so what comes after better? So when better just isn't enough, then you strive to become the best. And in the best, there are 100 levels of the best. The best means that you're at that next level and you are continually growing. You never stop learning. A handful of points or protocols isn't enough anymore. You want techniques, you want strategies, you want to put it all together. You continue to learn from the masters. I have had the opportunity to study with Dr. Noget, Dr. Nimtzow. I have met Terry Olson, had him sign my book. I've even met Dr. Huang. I meet them at these acupuncture symposiums that I go to. I study their books. I study their information. I have access to ask them questions. It's exciting to go to the next level. So let's talk about what a master really is. I consider these people masters, but I think you could be at the master's level as well. A master is someone who possesses or displays great skill or technique. You're getting extraordinary results. You're consistently getting good results, and you do all that you can so that you can learn with the best of the best. And really, it's you. You can step to that level. It's a matter of progressing and recognizing what your potential is and recognizing that you can progress to that level. The next thing I want to share is clinical applications and how over those years of me progressing, I have moved on to a new level and learned some new things. At the first level, when I was fresh out of school, new at Meridia Technology, I was in the process of doing research on Auriculo. I actually was in a networking group. I didn't have very many patients in my clinic, and I had met with this gentleman. We're giving you a link of all of these videos so you can go watch these videos, but this video you can find on YouTube. And anyway, I went and met this gentleman at a business meeting, and he says, so Kimberly, tell me what you do. And I was telling him, and he goes, so you mean you study ear acupuncture? You can treat the ear and you can make pain go away? And I said, yeah, it's really a fascinating science. And he's like, okay, so tell me if you can make my elbow pain go away. Well, I wasn't really good at auriculotherapy at that time. And I sat there and went, yeah. And so I went into my Auricula 3D program. I looked up elbow pain and I said, let me show you what I got. And so I looked up the protocol, looked at it, put some ear seeds on his ear, and he goes, wow. He moved his elbow around. He goes, I think I'm a little better. And then a light bulb went on in my head. And I remembered from my studies from the masters that the back of the ear worked for muscular pain and the front of the ear worked for tendons, bones, and ligaments. So I quickly added more ear seeds to the back of the ear on the same exact location that I had treated on the front of the ear. And I pressed on them and I said, how's that? And he moved his elbow around, his jaw dropped, and his pain was gone. And he said to me, I can't believe that you just did that. Well, from that, it turned out that we went back to our networking meeting. He told the whole group how awesome I was with auriculotherapy, which it really wasn't that awesome. I was getting better, but it wasn't that awesome. And pretty soon I had a reputation and I had a ton of patients coming in. And so then I began practicing and it went to the new level. After that, because of what he had taught me, I moved on to shoulder pain, and I didn't even, in the elbow pain protocols, I didn't even know about finding electrically active points. And after that point in time, I learned about the Stim Plus Pro, and I began the process of finding electrically active points on the ear. And instead of treating every point that came up in a protocol, I just treated the ones that were electrically active. And with that, then came my famous shoulder pain YouTube video, which I got a reputation in my town for being amazing with shoulder pain. And with those types of protocols, I would treat the body. And then when the patient got off the table, if there was some residual pain left, I would say, well, sit down. Let me see what I can do. I would treat the shoulder pain on the ear. After finding the electrically active points, I would put ear seeds on them, front and back, press on them, and then have them recreate their pain. And again, their jaw would drop and they would say, it's gone. And so I would send them home with the ear seeds so that they could press on those points. And so they would press on the points and self-treat from home. And that's really how shoulder pain became such a big hit in my clinic, because they had a way of supplementing the treatment until I saw them again. Let's see, where am I at now? So the next level is, what's next? Are you really the best? And in order to become the best, you learn from the masters. And when you go to these trainings, you get these little golden nuggets of amazing information that they just keep dropping. And as they drop those little golden nuggets within a seminar, then you get better and better at what you do along the way. So here are the pictures of the masters again. And the masters, the things that they teach at these seminars are the wows of their clinic. The things that they have learned are the best of the best. Many of them have written books. Many of them are teaching classes. And what I'm recognizing is they're getting older. These are the people who began the teaching of auriculotherapy back in time. And I am on a mad, passionate, my goal is to learn as much as I can from them before they're not teaching anymore. I have developed a protocol of my very own that So when I say master's level, I would like to hope that I'm reaching that point where I'm into the master's only because I'm sharing and only because I'm teaching, not because I think that I know more than any of these other practitioners. But at some point in time, you begin to get those little tidbits and you begin to put it together. And I have recognized that many of them are they're incorporating key acupuncture points that really work on the ear, and then they're incorporating other techniques as well. So this is one that I'm going to share with you. And I treat this protocol at least once a month, and I get absolutely fabulous results for hemorrhoids. And this information is in your handout. But this is when you give it all you got. So this rectum point, and this is the European rectum point. I learned that when someone has hemorrhoids and you scan the ear, and if you did a whole hemorrhoid protocol and you brought the whole protocol up, this is the point that screams electrically active. And before I began treatment, I actually put in a gold ASP needle in this point bilaterally. And then I use all of the classic TCM points for hemorrhoids. The reason they're classical is because they work. I mean, really, you can't do better than bladder 57, bladder 30, and the top of the head at GV20. And then I add GV1, do one to the treatment. And then what I've learned, I used to just do that. Before I was really into the auriculotherapy, I would just use the classic points and I would get okay results. And then I added the auriculotherapy in, and I got great results. And then the other aspect of hemorrhoids is that it's a blood stagnation type of problem. And I learned that if you add this actual herbal formula, Meridian Passage, it's from Con, and it is a classic blood stagnation formula. It's a big blood mover. That is the magic that helps people who have chronic hemorrhoids or extreme hemorrhoids that won't go away. Adding that herbal formula and the gold ASP needle is absolutely fabulous. And then another tidbit that I've picked up along the way is tea tree oil. Watered down tea tree oil on the hemorrhoid will help the hemorrhoid to have immediate, it'll go down immediately. It won't stay down. None of these treatments work all by themselves, but if you put them all together, then this has been a really helpful formula. My next, I know you have questions. Let's see. And I will get to them in a moment. I just have a couple more slides of what I want to share before I get to questions. So more golden nuggets that I have learned along the way. That's funny. We were at hemorrhoids and now I'm moving to golden nuggets. So Auriculo 3D. When I was studying the Auriculo 3D formulas and when I studied the works of Olson, Huang, and Longren, here are some key points that I'm going to share with you. That, and I said it earlier, that a picture is just a picture. One picture does not mean that it's the exact point location. Please don't ever get stuck into looking at a point location and say it has to be exactly right here. When you learn to find electrically active points, then your whole world will open up to a whole new level. Lesson 2, the French and the Chinese have different locations. And when I helped create Auriculo 3D, we put both types of points into the protocol or into the system because there are those who want the Chinese points and there are those who want the French points, and we wanted to have a database that had everything. The key is to try what works best for you, and you will begin to see which ones are electrically active. And as you become a master, you'll be able to fine tune what works best. The back of the ear, which I talked about earlier. I learned by studying these resources that if you massage the ear and you massage the entire ear with treatment, that it's like a full body massage. You are literally affecting the whole body. Since then, I've learned that I can massage areas of the ear based on protocols. So if I have someone who has, so my classic shoulder pain protocol that I love to use, or neck pain or scapula pain, I actually can go in and I can manipulate those tiny points and rub an ear. I've rubbed my husband's ear on an airplane when he had shoulder tension. And because that point protocol is so ingrained in my head, just by rubbing it and treating it and fine tuning those little points, I can get shoulder pain relief. So you can massage points and get relief. And then the other thing is, you'll see a lot of controversy in the world of auriculotherapy, whether or not you can treat a pregnant woman or you can't treat a pregnant woman. And I won't comment on that exactly, because there are a lot of different protocols, but I can say, based on studying the classics from these authors, that pregnant women can have the NADA protocol. So you can feel very comfortable with the points related to the NADA protocol on a pregnant woman. And so there's a little tidbit to share along the way. Let's see. Next. So when I studied the NADA protocol back in college, here are some tidbits and pearls that I'm taking from my notes to share with you that might be helpful for you in other forms of treatment. So when you are treating this combination of points, you're getting a dopamine response, which dopamine is the feelings that are received when somebody is addicted to drugs, because they have this happy feeling inside and they're addicted and they want that happy feeling over and over. You're actually recreating that happy feeling with these points. So think of somebody who's unhappy. Well, the lesson number 2, this protocol, I was amazed at the end of 2 days of studying with this woman, how many things this protocol could treat. It treats emotions, digestion, sleep, libido, pain. So you could think of this handful of points, this protocol, in relation that fits almost every patient that comes into your clinic at some level, right? They either come in with pain or emotional imbalances or insomnia. You could use the NADA protocol as a go-to for those. The other lesson that I learned when studying with this particular practitioner is that anyone who is addicted to drugs has yin deficiency. So even though their symptoms look excess, it is because of an empty fire that they're having these symptoms, and you must nourish yin. And the point is, the NADA protocol does nourish yin because you're treating kidney and liver. And the kidney and liver nourish yin, so that's automatically happening in the protocol. But another thought process is, if you added yin nourishing herbs to a protocol, it can be beneficial. The other thing I learned from this practitioner is that it's called a delayed bleed. If you were putting needles in an ear and you pull the needles out and you think that you're all done, and you tell them, okay, we'll see you next time, and they walk away, what they have learned over time is that after you pull needles out, sometimes there's a delayed bleed and there's a pool of blood that lands in the cavum concha after the fact. So I learned that right from the beginning. And so I always watch, and there are those occasional patients who will have the delayed bleed. And so I'd rather recognize that than have a patient walk out of my clinic, walk down the hall, have blood dripping down their face or out of their ear, and have an awkward situation in the waiting room. So you're welcome. That's a helpful little tidbit that everybody should know about. And then if you're doing a NADA treatment protocol for drug addiction, 5 times a week is best. 3 times a week if they're not in an acute stage, and as you are moving on with treatment, 2 times a week. So there's a little tidbit for you without having to sit 2 days in this seminar for you. And then here's the great take home. Someone who is addicted to drugs and they have a baby, then you have these little babies who have drug addiction based on childbirth. And you can treat these babies with the NADA protocol with ear seeds. And it's very very good to teach the mom, send them home with ear seeds, and they can self-treat themselves. They'll fall into that good category. They won't be better or best, but I would much rather see a mom who is good and able to treat a baby going through these symptoms than to not have any treatment at all. One more. Recently, I studied with Dr. Richard Nimtzow for battlefield acupuncture, and he's another one of those practitioners who is getting older, and he's not going to be around forever, and I am so glad that I learned with him. So a few tidbits that I learned from him is a point is just a zone. It doesn't match a picture. So similar to what I've been telling you all the way through, don't get stuck on exactly where a point is in a picture. He always treats point 0 a little further out. And I have a picture of that I'll show you in a moment. He has also said that if you are doing the battlefield acupuncture protocol and you are not getting any results, perhaps the ear needs to be recharged. And so what he'll do is he will treat point 0 at 10 hertz for 2 minutes on each side and then try again. And then the battlefield acupuncture will work. He also, in our Auriculo 3D program, if you open up the battlefield acupuncture protocol, there's a list of instructions on how to do this protocol. And when you find that one point that is resolving pain, if it resolves it by a small amount and you want to resolve it further, he does a cluster of needles. He's using ASP needles, and he'll cluster needles at one point and get better results. And then I learned that he includes a lot of other therapies in his treatment. And one of the therapies that he includes, if somebody has, so there's battlefield acupuncture, where that's all you're doing is the ear. And then if they're coming into the clinic and they're just having general shoulder pain and it's not the extreme pain, and he's just doing a shoulder pain protocol, he treats the ear, but then he'll use the piezoelectric pen and treat trigger points on the body. And I've been pretty fascinated with studying that since I went to his training. I've studied acupuncture points, and I'm pretty good with musculoskeletal stuff, but I've begun studying trigger points at a deeper level and using the piezo pen. And if I have time for a quick story, I was camping a few weeks back and I did not bring a single acupuncture needle with me. The only thing I had were ear seeds and my piezo pen. And my daughter-in-law was having TMJ pain radiating into her ear. And so I put a few ear seeds on and got her pain resolved a little bit. And then I used the piezo pen on trigger points on her body, and her pain was completely gone. And it's pretty hard to resolve TMJ pain that quickly without any needles or big long treatment. But in 5 minutes, it was gone. So learning from the masters gave me one more bit of wow therapy. All righty. There's that Nimtzow point for point 0. You can see that I saved that in my Auriculo 3D of where he puts it, just because I wanted it as a reference. And then he has another point that he taught, and he calls it the N point. And the way he found that point was simply, he was about to put a needle in the ear for a headache, and somebody walked in the room and he missed the ear and wound up with the needle in the head, and it resolved the headache. So now he calls it the N point. It's the Nimtzow point. So there's the story behind it. And it's, he swears by it for headaches. He says it works every time, period. And that is his reaction. Then finally, Dr. Noget. So you've heard us talk a lot about Dr. Noget. I am blessed to be able to study with this man. He comes from France, and he brings an interpreter, and he teaches the most fabulous auriculotherapy training. And last year, I thought I was pretty good at auriculotherapy. It's before I recognized good, better, and best. And I went there and I learned that I didn't know anything. And after working with him, I learned that I could actually balance a graph by scanning and treating a root treatment in the ear. I learned that there are acupuncturists who are so good at auriculotherapy that they can treat one ear or one point on one ear and make sciatic pain go away. If you've ever treated sciatic pain, it is not the easiest to treat, even if you're treating on the body. And I was in awe at watching him treat patients that weekend and have sciatic pain be gone. Scar tissues on the body, they resonate in the ear, and you can actually treat those scar tissue imbalances on the ear. You can treat dental blockages from the teeth on the ear, and learning the electrical frequencies of organ tissues from him. I cannot wait to go back and learn from him this next year. And I'm going to let Dr. Larson pop in here for a second. And I need to go offline for just a minute. Are you there, Dr. Larson?
I am here. You need to, are you done sharing your screen?
I am done sharing my screen.
Okay, you can close that and I will be back active, and then we'll start taking some questions as soon as you're back on.
Okay, I'll be right back.
Oh, there we go. Okay, well, as soon as Kimberly's back with us, we will have her answer these questions. I noticed that we have a few folks that have already asked questions over here in the chat window. So this is the time to type your questions. This is the time to pick Kimberly's brain, ask about anything. I particularly like the notion of kind of having a roadmap for where to go next, for what to learn next, because I look at my own journey in auriculotherapy, where I started, and I still remember vividly the first class I took and how impressed I was. And I look at where I'm going now. I've been going to the courses that Dr. Nogier teaches, and I've gone for several years and still feel like I have so much to learn just by watching him work and learning all of the little obscure, I guess, tips and tricks and pieces of knowledge, but it's so helpful and I'm getting better each time. So with that, let's go ahead and get some questions going here. And hopefully Kimberly joins us back again soon.
I am back. Can you hear me?
Yep, we got you, Kimberly. Oh, there you are.
I
did not see you. Okay. Kimberly, we've got some questions. You want me to go ahead and start reading them out for you?
Sure, that would be great.
Okay, so Elaine said, herb formulas for hemorrhoids often assume constipation and painful tissue. What is good for those with diarrhea and yet bulging? Something, and sometimes bleeding. Blood movers with these people cause more bleeding. So do you have something in mind when it's not constipation?
My experience has been when there is a hemorrhoid that is large and activated, a quick treatment with blood stagnation, because it's still blood stagnation in the rectum. And so I have multiple approaches that I use, and I will treat acupuncture. I mean, if there's diarrhea, I will treat acupuncture points for the diarrhea, but I always find that I don't keep them on it long term, but if I can get the blood moving, that's what I do.
Okay, cool. Next, Dana says, on tea tree oil, you mean essential oil, right? And when you say watering it down, do you mean diluting it with oil?
Yes, or watered down somewhat in a spray bottle so they can spray it on, they'll either spray it on the rectum or dilute it down with oil and pat it with a cotton ball. If it's a hugely enlarged hemorrhoid this is the type of situation where if they don't get it resolved, then the doctor is saying, yeah, we need to do a hemorrhoidectomy. So we want to help them avoid that.
Okay, great. Let's see. Elaine asks, does vigorously massaging the ear change the readouts by microcurrent? So in other words, I guess if you measure it first and then you vigorously massage, are you going to have different points or more points showing up?
Well, if I was using microcurrent, I wouldn't be vigorously massaging the ear. I would be microcurrent. I would be looking for the electrically active point and treating. But if I'm in a car ride with my kid sitting next to me in the back seat and they have a problem, then I'm going to use massage as my option. Or if I was a massage therapist and I didn't have the ability to use other resources, so I wouldn't use both.
Okay. And I'll add, that's a great point, Kimberly. I'll add that the question is good because, yeah, vigorously massaging the skin will change the electrical parameters of the skin. That's a given, and that's kind of well known. So I appreciate you drawing the distinction that you probably wouldn't be doing both at the same time.
Well, and oftentimes people think when I say that I do something that is the only way I do it, and I do things differently depending on the patient and the circumstances.
Right. Okay. Good point. Let's see. Elaine says, was that headache point under the rim, on the edge, on top, behind?
All right. I'm showing you in the screen. It literally was right here on the head.
It was on the head. Okay.
And it kind of fits. It kind of fits a reflex point for gallbladder channel headache pain. And it also is on the gallbladder channel on the ear. So it makes sense on why it would work. It was just interesting that it became the end point because Richard Nimsow found it. And
so it got to be N.
By accident. And it was just by practice. The whole point of talking about that was in your practice of what you do, you will find what works. So me and my hemorrhoid protocol, or me and my shoulder pain protocol, or Dr. Nimsow and his endpoint.
Okay, cool. Let's see. Cheryl answered Elaine's question. On the head, perpendicular to the superior crus of the antehelix, right at the top edge, right at the edge of the ear. So thank you for that, Cheryl. And we've got more questions I'll be answering, or I'll be directing to Kimberly, but I wanted to point out that I have put up the link to all of the resources that Kimberly talked about in her presentation today. There's a bunch of web links where you can go look at information, download information, learn things, various equipment materials available, and it's all there in the PDF. Just click to download that PDF and get your hands on those things.
One of the things that is on that PDF is an interview that you and I did a while back where we talked about the whole journey of auriculotherapy. So I didn't talk about that in the webinar, but we put it there. We just wanted to give you as many auriculotherapy resources and make this hour of your time worthwhile.
Excellent. And thanks for putting that together, by the way. I was impressed when I saw it. Mary Jill says, Kimberly, are you always using the Stim Plus Pro for the ear and or for the initial measuring? And do you also treat with the Stim Plus Pro, not with needles?
So I always use the Stim Plus Pro to find the active point. And I say always, that's if I have a Stim Plus Pro in my hand. If I don't have, if I'm out and about and I try to have one always in my purse. So almost always I will use the Stim Plus Pro. If I don't have that, I'll palpate to find the active points the old fashioned way. But the Stim Plus Pro finds the points, and there are many ways you can treat the ear. You could treat the ear with laser. You could treat the ear with needles. You could treat the ear with ASP needles and ear seeds. If I'm just in my clinic for quick ease and convenience, I will find the active point, push the button, and treat it because it's right there. But if I, at the end, if I need to put an ASP needle in, I will. So I use it in different ways.
Okay, excellent. Larry says, is the endpoint between GB7 and GB8?
Cheryl, a few question marks down, put kind of the exact, if you were looking for an exact location. Again, it's going to be one of those things that you could Google him and see what he puts up. I put a picture of it in the protocol.
And that's a pretty good approximation, but
yeah, it's off of, it's a fall off the ear, and the picture shows where you're falling off the ear.
Okay, great.
Remember what we said about exact locations. Exact isn't exact.
Yeah, the point is where you find it.
Exactly.
Okay, Dana said, are you going to offer a discount on enrollment with Dr. Nogier's seminar? I went last year, was under the impression that we could repeat at a discount. Yeah, there is currently a discount available. You can go to the website, auriculotherapyseminars.com, and there is a discount available. All of the repeat attendee discounts, they're all sold. They sold out really quick because a lot of people love to repeat. But there is still a good discount available. So yeah, go check that out. There are a limited number of seats, and they've been selling faster this year than ever before. And it sells out every year. So if you think you'd like to go see Dr. Nogier live in October in Maryland, then scoot on over there and check it out now. Get yourself on the list. It is fully refundable through August 1st. So even if you need to make travel arrangements, you could still get on the list, get your seat reserved, and then worry about your travel arrangements. You have a few days yet to get that taken care of. Next, Elaine says, can the auricular point on Stim Point Pro or Stim Plus Pro, I think, be glued into place if I only want to use it for auricular treatments? The little tip that comes with that, I don't like it because I find it too sharp and too needle-like. However, yes, you could glue it on there, or if you mentioned yours was getting loose, we do have replacements available if that's the tip you like. I find it that I never use it. I just like the little round one that's built into the machine, and it works beautifully.
My patients don't like the sharp one. They say it hurts.
Okay, yeah, and I get a lot of that as well. Diana says, is the sciatica point on the 3D too?
Yes,
Thanks, guys. Yes, it is. And yeah, watching last year when Dr. Nogier taught how to cauterize that point was one of the most impressive things I have ever seen at a seminar. I was absolutely blown away. And it works. It's incredible. So, okay, I don't see any more questions on the list, and we are past our time. So, Kimberly, do you have anything to add before we close up?
I just want to say thank you to you for all the opportunities that I get to learn and continue to grow in this field of Chinese medicine, and especially in the world of auriculotherapy. I really feel like because of all the research that I've done through Meridia Technology and the trainings that I get to go to, I get to rub shoulders with the best of the best. And I hope that if you are wanting, not you, Dr. Larson, but the rest of you are wanting to expand your knowledge in auriculotherapy to the master's level, that you'll come rub shoulders with me with Dr. Nogier in October. It's beautiful there in October, and it has been life-changing for my practice.
Absolutely. Absolutely. Thank you, Kimberly. Excellent presentation today. I learned some things that I didn't know. And these tips you have from the masters, I love the way you synthesize stuff and put it together. So thank you, everybody, for attending. Don't forget to grab that download. And we will look forward to seeing everybody next month in our webinar, and hopefully seeing a lot of people in October with Dr. Nogier. Thanks. Bye, everybody.
Bye-bye.